next professional that is going to come out probably is going to be your physical or occupational therapist. So we'll start with physical therapy. Physical therapy is going to come out, and they're going to look at how you walk, which is they'll say we're going to look at your gait. So they're going to look at how you walk. They're going to do some testing to see what your balance is like. They're going to do some testing to see what your strength and your endurance is like, what your mobility is or your range of motion. They're going to look at your ability to move around in the bed, how you get in and out of a chair, how you get in and out of the car. The physical therapy session is going to be really active, so get ready. When the PT comes, if you're in pain, you make sure and you take your medication before they get there, because they are going to be moving you around quite a bit. And chances are they're going to set up a really great program for you to make sure that your balance improves and that you're not going to fall in your home. They will often make recommendations for an assistive device, be it a cane or a walker, whatever it is that you are going to need, they're going to recommend for it. That brings me to occupational therapy. Occupational therapy also makes equipment recommendation, and they really look more specifically at bathing, at getting in and out of the bathtub, showering, making sure that you can reach all your parts when you're in the bath or in the shower. They're going to look at how you're doing in the kitchen, managing the pots and pans, and standing and turning, and doing all the things that it takes to manage a kitchen successfully and to cook and those kind of things. And if I didn't mention it before, they're also going to look at your ability to toilet yourself, and they may make a recommendation on getting a 3-in-1 commode, another item that's covered by Medicare, along with the walkers. 3-in-1 commodes are usually covered. They do require a physician recommendation, but they're covered. And they may make other recommendations for you in your bathroom, like grab bars or rails. They may recommend a reacher for you, just whatever they see in their assessment. And some of those things may not be covered, but they're things that they will want you to know about, and things that might benefit you to stay safe in your house. So the next one is going to be the speech therapist may or may not come out. Everyone, when they hear speech therapist, sometimes the red flag goes off. Oh, I talk just fine, or whatever it is. I think people get kind of squirrely when they hear about speech therapy. I hope I don't have a bunch of speech therapists blowing up this video saying, what are you talking about? But speech therapy is wonderful, because they're going to look at your speaking, they're going to look at your memory, anything dealing with cognition. They're going to look at swallowing, and they have a really neat assessment to see how things are going, especially for people that are coming in to see us having had a stroke or a head injury, or that just have anything that presents like a mild dementia. Speech is going to be great. The next part of the team is a social worker. The social worker is going to come out, and really they provide you with resources, community resources, financial resources. They're going to give you phone numbers, and they're going to coordinate care with different places, so you have knowledge of what's available for you in terms of living arrangements and financial arrangements. And they're really a necessary part of the team. They don't come as frequently as the treatment team, but they will come out probably once or twice, and leave you with everything that you need to make your decision about what the next step will be for you and for your family member. The last part of the team is the home health aide, and the home health aide is going to potentially, give you a bath or a shower, assist with basic grooming and hygiene needs. What the home health aide is able to do for you, I find it seems that it varies from state to state. Down here in the Southeast, the home health aide is going to provide a bath and basic assistance for the patient. Not really so much assistance, cleaning or straightening things, but really the care is going to be specific to helping the patient do a bath. mainly. So anyway, you can ask questions or make comments if you're in another part of the United States where the home health aide does more. Well, let us know. That's how it works down here in the Southeast. But that pretty much covers the skill team, and what they do. And just it's a very a brief overview, but that covers a lot of us.